everyone. Welcome back to another episode of Mind Over Masculinity, the podcast where modern men get real about mental health, physical well being, and the emotional resilience. I'm your host, Avik, and today we are diving into a topic that doesn't get nearly enough attention in men's wellness conversations, which are chiropractic innovation, right? So from soft wave therapy to PEMF and low level laser treatments, today's guest is not only on the cutting edge of physical health, but he's also redefining how men approach healing, pain, and performance. For joining us is Dr. Brian Donovan. So welcome to the show, Dr. Brian.
Hi, thank you. Thank you. Happy to be here.
Amazing. Amazing. So Dr. Brian, before we delve into this discussion today, I'll quickly love to introduce you to all the listeners. Dear listeners, Dr. Brian is the founder of Nuro Chiropractic PLLC in Brooklyn, with a background in evidence-based neurologically informed care. His mission is all about helping people not just feel better, but function better. Yes. And he's here to challenge the outdated beliefs about chiropractic care, like share some of the incredible science and open our eyes to the new possibilities in healing and human potential. So, wait a bit, let's get started. Welcome to the show again.
Thank you. Yes.
Amazing. So, Dr. Brian, um, was there a personal experience or maybe a aha moment that uh, lit this path for you?
Yeah, I wouldn't really pinpoint it to a one experience. It was kind of an accumulation of experience that I had during chiropractic school.
Oh,
Towards the end of the chiropractic program, it's a 4-year program, and in my last 2 years, I ventured off and shadowed over
mm.
20 doctors in the area in New York and
Oh,
Connecticut, Jersey. Yeah, so I got a good feel about what was out there in terms of
mm,
chiropractic, and it was very different from certain things that I was taught in school. My school is credited as an evidence-based chiropractic school. It's not really focused on philosophies of chiropractic care or
mm.
theories of the adjustment. It's based on science, data,
Yeah.
using the best literature. And I didn't see that out there. I saw a lot of
Mm,
old school docs kind of doing the same types of treatments on people.
mm,
Their rationale for the treatments weren't rooted in true science. And I felt like I and many others like
mm.
myself could do much better.
Exactly. Wow. So, if I ask, like, when you started, did you really? Did you already envision the integrated advanced tech like the software or PEMF, or just it did evolve over the time?
It was more of an evolution, I believe. Yeah.
Mm,
Like I said, I'm constantly doing research, looking at PubMed, finding the most up to date articles, the best research
mm,
out there. And these were some devices that I knew that had really good evidence for them that I could
mm.
bring as an adjunct therapy to my patients.
Okay. Hmm. And also soft web therapy is gaining the traction, but many of our listeners have never heard of it. Definitely. So,
Mhm.
if you can just break down like what it is and how it actually work.
Yep. So SoftWave is a company that makes extracorporeal shockwave therapy devices. Um,
Mhm.
the the founder of the company was actually an inventor of one of the devices used for kidney stone removal called lithotripsy. So
Mm,
he started, and that was in the 90s. So he started using that same device, which basically breaks up kidney stones without having to go in surgically. He started using that device on tennis elbow and runner's knee and found really good results. So they figured, well, if it works on these tendons in the knee and elbow, it could work in tendons on the shoulder and the spine and you name it, pretty much anywhere else. So fast forward 20 years, they developed SoftWave. And the way it works is
mm,
it uses sound waves that travel 5 times the speed of sound that make micro tears on the cell membranes
Mm.
of our body. So micro tears are totally harmless to us, but it tells the brain that there's damage in the area, which in turn the brain sends blood flow, anti-inflammatory cells, and more importantly, stem cells. And that's kind of what
Yeah.
is key about SoftWave, that it separates itself from other modalities, is it's not just reducing inflammation or pain, but it's also giving a more permanent solution by having the stem cells repair those tissues in that area.
Okay. So, like, what kind of conditions or the issues in men's health respond best to the software?
So I typically use it for
Mhm.
chronic pain patients that don't have any trauma. So the patient that
Okay.
comes in saying, I've had knee pain for 10 plus years and it won't go
Mhm.
away, or my shoulder has been hurting for the last 5 months and I didn't do anything to it. I feel like I
Mhm.
slept the wrong way, or something
Yeah.
along those lines, where there's no traumatic event or true mechanism, but they're obviously in pain. There's obviously some inflammation and tissue damage, whether or not it's acute or chronic.
Mhm.
This SoftWave is definitely able to fix that.
Got it. And okay, and PEMF therapy, which is correct me if I'm wrong, it's pulsed electromagnetic fields, right?
Yep, yep.
Yeah, yeah. So,
Frequency.
frequency. Okay, sorry,
Yep.
my bad. So,
No, it's okay.
so which is, I mean, definitely another intriguing one as well. So, there's a lot of buzz also as around. I can see on internet, like in the groups and all that. There is a discussion. So, uh, about its neurological benefits. So, what's your take on this?
So I won't really say PEMF it
Mhm.
by itself has a neurological benefit. I mean, it does, but not directly. But all
Okay.
chiropractic care, all physical
Mhm.
therapy, all these modalities, the main purpose is to correct error, right? We are fixing errors in the body, whether that be joint fixations, joint
Mm.
malpositions, torn ligaments, torn muscles. These are errors. We
Mhm.
have a sympathetic nervous system and a parasympathetic nervous system. Sympathetic nervous system is our fight, flight, or freeze. It's our protective mechanism. So if we're in the jungle and a tiger pops out and tries
Mhm.
to eat us, we're either going to fight it, freeze and not know what to do, or run away. Our
Mhm.
parasympathetic nervous system, is our rest and digest. So this helps things like um, breathing, metabolism, lowers your heart rate. So when we have error in the body, let's use that tiger for instance, whether that be pain or something wrong. If the tiger scratches you, now he's damaged the tissues, he's caused pain. Now our sympathetics are going to upregulate, our
Yeah.
parasympathetics are going to downregulate. The major symptoms of an upregulated sympathetic nervous system are things like anxiety,
Mm.
obviously pain as well, increased perception of pain, sweating, fast heart rate, high blood pressure, and the list goes on. But these are a lot of symptoms that people will feel in anxiety attacks or panic attacks, and it might not be related to something thought provoking or situational anxiety or panic attack. It could just be because their body is in this chronic state of error. And
Mhm.
the longer you're in that state, the body only has so much adrenaline to fight whatever it thinks it has to fight off. So eventually you become very fatigued and feel like you're very lethargic and don't have a lot of energy. This could lead to things like depression. So the main goal of all this chiropractic
Mm.
treatment and everything else is to fix that error. And in turn, we're going to downregulate that sympathetic system, upregulate the parasympathetic, which will have you in a more relaxed, state of mind and overall body state, where you're able to digest better, feel more relaxed. So yeah.
Okay. Okay. Understood. And so, can PMF also support the mental health or maybe the emotional
Yeah,
regulation in men?
sure. So using that same concept though,
Mhm.
right? It's not PEMF and SoftWave are not just a one shoe fits all approach. You can't just slap it on a patient and say, fingers crossed, I hope it helps their neurological or mental health. It has to be used in the right clinical setting, that you have to detect the error first and diagnose them properly and make sure that PEMF is indicated as a good treatment. PEMF is really good for fractures, whether they're hairline or non
Mm.
union fractures. such as like rib fractures or metatarsal fractures that take a while to heal, PEMF has been shown to cut that treatment time in about one third. So it usually takes 9 weeks for a fracture like that to heal. PEMF has been shown in many studies to heal these fractures in 6 weeks. So the quicker we could get that broken bone, that error in the body back to normal, the quicker we could upregulate that parasympathetic nervous system and get their mental health back to normal.
Wow, amazing. And like, I mean, definitely I have to say this, that the link between the nervous system and the emotional resilience is huge. And too often we try to think our way out of anxiety, but the body is a portal as well. Yeah.
Mhm.
Yeah. So laser therapy also sounds intense, but you specialize in low level laser, right? So,
Mhm.
um, so like, how does that differ from the traditional lasers, and what makes it useful in your practice?
So it's similar to cold lasers. That's just typically used in practice. The difference between just low
Mm.
level laser therapy is you're not just using one type of laser device, whether that be
Okay.
ultraviolet rays or UV. Sorry, ultraviolet red light therapy or other types of lasers. There's different types. This one uses kind of all of them. So you're getting all the spectrums of light and different rays going into the body, which are able to penetrate the skin a little bit deeper so it can get to those targeted tissues. The way that laser works is it activates the mitochondria in your cells to produce more energy, um, activates them to work better, basically, because mitochondria produce ATP. And if you have an injured area in the body and now we're increasing the mitochondrial activity, that's going to increase the repair process and decrease the repair time. Same concept, getting you out of that error sympathetic state sooner.
Amazing, amazing. So that's really lovely. And so, are you seeing men use it not just for the pain relief, but also for the performance enhancements, like recovery from workouts or optimizing functions like this?
Um, it's tough to say. I think for like an athlete who is chronically making micro tears in their body all day long or, multiple
Mm,
times a week, I think it could be beneficial for something like that for
mm,
improved performance. But you would need a lot of lasers for that because the lasers that we use are very focal. We're usually treating one area at a time. For an athlete, let's say, that's going to take for
mm,
many different areas. So for them, we would usually use a laser bed sheet. So it's like a long sheet of lasers that they could even go to bed at night and sleep right on it, to
mm,
treat a much broader, larger area.
mm. Got it. Yeah. So that shift from injury recovery to performance optimization is the key. And a lot of men also show up when they're broken, but what you're offering is a blueprint for the long term vitality. So that's great. Yeah. So, in your experience, what are some of the biggest myths about chiropractic care that keep men from seeing it?
Yep. So I would say there's
Mhm.
two major myths. One
Okay.
is a much broader one, and that is that
Mhm.
chiropractors aren't real doctors.
Ah,
So the rationale of the people that say this is, well, chiropractors didn't go to med school, they don't have an MD. And my rebuttal to that would be, then what are we considering a doctor? What makes a doctor? Is it just that they go to med school? Then I guess we wouldn't consider podiatrists who are able to treat, diagnose, prescribe medication, do surgeries doctors, or doctors of osteopathic medicine who have a DO, not an MD, didn't go to medical school, went to osteopathic medicine school, and same thing, they're to treat, diagnose, do surgeries. So we have to understand what makes a doctor. And if you look up what makes a doctor, it's pretty simple. It is a person who is legally allowed to treat
mhm,
and diagnose patients. And chiropractors are able to do that, unlike physical therapists in most states who aren't allowed to diagnose. We are. Although we can't do surgeries or treatment, that shouldn't mean that we're not doctors. In fact, we're trying to avoid prescribing these very debilitating medications or these really debilitating
mhm,
surgeries. And I think that there's a big distinction there where we're more so looking at treating function. We want you to function better. The second that you go to an orthopedic doc or spinal surgeon and ask them to treat you for function, this is where we mess with people's lives because their way of treating function is doing surgery. And that has been shown time and time again to not increase functional activity. In fact, it can make it worse. So we have to be very careful and try to stay in our scopes, both MDs and DCs alike. But the second myth is that chiropractic care causes strokes. And this is a very scary one because if you told me that there's an increased chance that I go to this doctor of chiropractic and I could get a stroke, I definitely wouldn't go to him. Why would I want to risk something like that, even if it's going to make me feel better? So this is just something that I see all over social media, and it's not the case at all. They've done many studies on cadavers and other like animal studies on the adjustment and how it affects the vertebral and carotid arteries, and there's been no correlation to a cervical adjustment or to an artery dissection or stroke. And in fact, they've done other correlation studies and compared the prevalence rate of strokes, whether they be ischemic or hemorrhagic, in chiropractic care versus the general population versus people that want to just go see a PCP or an MD for a checkup. And they're all the same. The prevalence rate is all the same in all three categories. So whether you're just a person walking down the street or a person going to receive chiropractic care, there's no you're getting the stroke rate about the same rate, 1 in 300,000 people. Um, but people use that as a fuel if there are times where chiropractors do have patients that have strokes, and that's because just the general population has a prevalence to get a stroke. And why would a person that is on the verge of getting a stroke go to a chiropractor in the first place? Well, stroke presents with headaches, dizziness, neck pain. People go to chiropractors for headaches, dizziness, neck pain. So it's not that we cause the strokes, it's that there are patients that are coming here with symptomatic sequelae of strokes, and it's just the prevalence of the general population. So there's no increased risk. I could say that with full confidence, and the evidence kind of points to that. But yeah, those are definitely the two biggest myths right now.
Amazing, amazing. Yeah. So, wow. And like also love to ask this, like some critics argue that therapies like PMF and SoftWave are still experimental and lack the mainstream medical acceptance. So, how do you respond to the skepticism, like especially in a scientific age?
Mhm. Yeah. So every treatment ever created has always been experimental before it has been, I guess, accepted, right?
Okay.
And I don't think that labeling something as experimental is necessarily bad as long as we're looking at the evidence as to how well it performs. And for something like SoftWave and PEMF, it's been around for 30 plus, 40 plus years of, and then throughout those years, the evidence just keeps getting better and better and more abundant. Um, and so I'm not really sure who is the person that says that, yes, this is accepted because the FDA has had many different clearances and approvals for the use of both modalities. In the Mayo Clinic, they use the SoftWave as well. It's on every major league team in New York, at least, and many other major league and Division One teams. It's actually used in certain hospitals in a sterilized unit to go over the heart and open heart surgery during um, heart surgery for increased ejection fracture of the heart. So if that doesn't say that it's accepted, I don't know really what does. I think it's the social media accounts online that are the people that are saying whether or not it's accepted or not. I don't think it's really the science community because science community, I think, accepts both of those modalities at this point.
Mm. Understood. Yeah, definitely. So that's lovely. And do you think that the healthcare system is too slow to embrace the innovation?
So I don't think that chiropractic care is because chiropractic care is an open door policy in every state. We are our own boss, which has a lot of responsibility, but also has a lot of potential. MDs have to prescribe to a certain set of guidelines for everything that they do. So if something works, but is not in that guideline, they can't do it because they're either working for a hospital or
Mm,
a facility like an urgent care facility, there are MDs that work by themselves, like internal medicine, and they could have the same type of you're your own boss. You could do what you want to do as long as it is shown in the evidence and is safe. But for the majority of MDs, they have to follow the guidelines that are prescribed to them through a hospital or urgent care facility. So they don't really have a choice whether or not to be in tune with the innovations. So it's kind of unfortunate, but chiropractors aren't in any hospitals. We usually don't work for any other major entity. So the only guidelines that we have to follow are: is this treatment safe, and is it efficient? Does it have good amount of evidence support with it? Both those check the boxes, and we are free to use it. And that's why I think that we are more inept to having more innovations in our field than others.
mm. Perfect. Lovely, lovely, Dr. Brian. I mean, thank you so much for not only sharing your wisdom, but also for being a pioneer in what I did call the future of feeling good. So that's amazing. And so, for all the listeners, like if your body's been whispering or maybe screaming, it's time to listen. Your health isn't a luxury, it's your legacy. So let's normalize the pain prevention. Let's embrace the innovation. So, uh, and let's keep showing up, not just for our hustle, but for our healing. So, Dr. Brian, if someone wants to connect with you, what will be the best medium?
So you could check out our website where we talk about all these different modalities and theories that we talked about today at mybrooklynchiropractor.com. Our office is located in Brooklyn, New York, 9408 4th Avenue.
Amazing. Yeah, great. Lovely. So, dear listeners, I'll put all the links into the show notes for easy reference. And with this hope, until next time, this is the host Avik signing off from Mind Over Masculinity. Stay strong, stay curious, and stay whole. So, thank you so much.